ಸರ್ಜಾಪುರದಲ್ಲಿ ಹಿರಿಯ ನಾಗರಿಕರಿಗಾಗಿ ಹೊಸ ಕೌಶಲ್ಯಪೂರ್ಣ ನರ್ಸಿಂಗ್ ಸೌಲಭ್ಯದೊಂದಿಗೆ ಭಾರತದಲ್ಲಿ ತನ್ನ 12ನೇ ಕೇಂದ್ರವನ್ನು ತೆರೆದ ಜೆರಿ ಕೇರ್. ವಿಶೇಷ ವೃದ್ಧರ ನೇತೃತ್ವದ ಹಿರಿಯರ ಆರೈಕೆಯ ಅಗತ್ಯವು ಹೆಚ್ಚು ನಿರ್ಣಾಯಕವಾಗುತ್ತಿದೆ. ಈ ಅಂತರವನ್ನು ನೀಗಿಸುವ ಸಲುವಾಗಿ ಭಾರತದ ಪ್ರಮುಖ ಸಂಯೋಜಿತ ವೃದ್ಧರ ಆರೋಗ್ಯ ಸೇವೆ ಒದಗಿಸುವವರಾದ ಜೆರಿ ಕೇರ್ ಇಂದು ಬೆಂಗಳೂರಿನ ಸರ್ಜಾಪುರದಲ್ಲಿ ಹಿರಿಯ ನಾಗರಿಕರಿಗಾಗಿ ತನ್ನ ಹೊಸ ಕೌಶಲ್ಯಪೂರ್ಣ ನರ್ಸಿಂಗ್ ಸೌಲಭ್ಯ ಮತ್ತು ಚಿಕಿತ್ಸಾಲಯವನ್ನು ಉದ್ಘಾಟಿಸಿದ್ದಾಗಿ ಘೋಷಿಸಿದೆ. ಇದು ಭಾರತದಲ್ಲಿ ಜೆರಿ ಕೇರ್ನ 12ನೇ ಸೌಲಭ್ಯ ಮತ್ತು ಅದರ ಉಲ್ಸೂರ್ ಸೌಲಭ್ಯದ ನಂತರ ಬೆಂಗಳೂರಿನಲ್ಲಿ ತನ್ನ 2ನೇ ಕೇಂದ್ರವಾಗಿದೆ. ಈ ಕೇಂದ್ರದ ಉದ್ಘಾಟನೆಯ ಸಂದರ್ಭದಲ್ಲಿ ತಮ್ಮ ಶುಭಾಶಯಗಳನ್ನು ತಿಳಿಸಿದ ಕರ್ನಾಟಕ ಸರ್ಕಾರದ ಆರೋಗ್ಯ ಮತ್ತು ಕುಟುಂಬ ಕಲ್ಯಾಣ ಸಚಿವರಾದ ಗೌರವಾನ್ವಿತ ಶ್ರೀ ದಿನೇಶ್ ಗುಂಡೂರಾವ್, ನಮ್ಮ ನಗರಗಳು ಬೆಳೆದಂತೆ ಮತ್ತು ಜನಸಂಖ್ಯಾಶಾಸ್ತ್ರ ಬದಲಾದಂತೆ ರಚನಾತ್ಮಕ ವಿಶೇಷ ಹಿರಿಯರ ಆರೈಕೆಯ ಅಗತ್ಯವು ಹೆಚ್ಚು ಮಹತ್ವದ್ದಾಗುತ್ತಿದೆ. ಜೆರಿ ಕೇರ್ನಂತಹ ಸಂಸ್ಥೆಗಳು ನಮ್ಮ ಹಿರಿಯ ನಾಗರಿಕರಿಗೆ ಆರೋಗ್ಯ ರಕ್ಷಣಾ ಪರಿಸರ ವ್ಯವಸ್ಥೆಯನ್ನು ಬಲಪಡಿಸುವಲ್ಲಿ ಪ್ರಮುಖ ಪಾತ್ರ ವಹಿಸುತ್ತವೆ. ಹಿರಿಯರು ತಮ್ಮ
probably consider ourselves still not geriatric, but we are going slowly towards that. And I think the care compassion which is required in any field of healthcare delivery requires more specialized kind of infrastructure and a specialized training for people who provide this care. And I think as a doctor who sees of a certain standard of care given, and there are various standards of care you see all over the world. I see facilities starting very brightly and very smartly, but the most important part for delivery of healthcare is always the quality, which we lack all over the world, all over the country. It's probably our nature that we start with a bang and then we lose our quality. The one reason for that also is there is an overwhelming need for care. We are not able to fulfill the requirement because we get overwhelmed with work. The need is so much. And I think a care like this, of course, where you have an intention to produce more and more centers where the care to, as Mr. Gupta also said, can be given.
Senior in the family can understand the trauma they go through. Helplessness what the caregivers go through, and in that regard facilities like Geri Care, which provide not only care home but home care, so those are very, very apt facilities. These need to be promoted, and our challenge is to find out how do we promote these facilities in a much larger way. Very frankly, the Geri Care facility at present, the costing cannot be afforded by many. So how do we bring out, the policies which make it affordable for people? It should not remain like a financial burden. And how do we bring a policy that this, what we use the word care, perhaps in any healthcare, care is very critical. But I believe, or I feel that care for the elderly who are dependent on somebody's care, attendant, that is the most critical aspect, because that person who is the receiver cannot even express because they know that they are dependent totally. They tend to get, undergo through neglect and abuse at times. So we need to, how do we create this system which, strength.
And Mr. K.S. Ravishankar, President Geri Care, to honor Dr. Sanjay Mehrotra.
Bangalore's second facility we are opening. This is the 120 beds skilled nursing facility. Mainly it's covered at OP services, physiotherapy and adult vaccination. And this is a center of day care, transitional care, palliative care, and the post-acute hospitalization care we are providing. And I think it's a fantastic, it's a very good, it's a physiotherapy department is there, rehab and physiotherapy department is there. And full time it's a clinical psychologist and it's a geriatrician lead organization, and is round the clock doctors available. And I think
Geri Care ಬಂದು ಬ್ಯಾಂಗ್ಳೂರಿಗೆ ಜೆರಿ ಕೇರ್ 8 ವರ್ಷದಿಂದ ಚೆನ್ನೈಯಲ್ಲಿ ವೆಲ್ ಎಸ್ಟಾಬ್ಲಿಷ್ಡ್ 5 ಇದೇ ಥರ ರಿಸ್ಪೈಟ್ ಕೇರ್, ಟ್ರಾನ್ಸಿಷನ್ ಕೇರ್, ಪ್ಯಾಲಿಯೇಟಿವ್ ಕೇರ್, ಪ್ರತಿಯೊಂದು ಹಾಸ್ಪಿಟಲೈಸೇಷನ್ ಅಂದರೆ ಪೇಷಂಟ್ಸ್ ಯಾರು ವ್ಯವಸ್ಥೆ ಮೆಡಿಕಲ್ ವ್ಯವಸ್ಥೆ ಬೇಕಾಗಿರುತ್ತೋ ಎಸ್ಪೆಷಲಿ ವೃದ್ಧರಿಗೆ ಅಂಥವರಿಗೆ ನಮ್ಮಲ್ಲಿ 24/7 24 ಗಂಟೆಗಳು ವೈದ್ಯರು ಮತ್ತು ಶುಶ್ರೂತರು, ನರ್ಸುಗಳು, ಕೇರ್ ಗಿವರ್ಸ್ ಅಂತಾದರೆ ಸ್ಪೆಷಲೈಸ್ಡ್ ಕೇರ್ ಗಿವರ್ಸ್ ನಮ್ಮಲ್ಲಿ ಅವರಿಗೆ ಶುಶ್ರೂಷಣೆ ಮಾಡ್ತಾರೆ. ಆಮೇಲೆ ಫಿಸಿಯೋಥೆರಪಿ, ಕಂಪ್ಲೀಟ್ ಬೆಡ್ ರಿಡನ್ ಪೋಸ್ಟ್ ಹಾಸ್ಪಿಟಲೈಸೇಷನ್ ಕೇರ್ಗೆ ವೆಲ್ ಎಸ್ಟಾಬ್ಲಿಷ್ಡ್ ಟ್ರೈನ್ಡ್ ಕ್ವಾಲಿಫೈಡ್ ಫಿಸಿಯೋಥೆರಪಿಸ್ಟ್ ಇರ್ತಾರೆ ನಮ್ಮಲ್ಲಿ. ನಿಮಿತ್ತ ದಿನಗಳಿಗೆ ಅಂದರೆ ವೆನ್ ಪೀಪಲ್ ಆರ್ ಟ್ರಾವೆಲಿಂಗ್ ಔಟ್ ಸ್ಟೇಷನ್ ಅಂಥವರಿಗೆ ಕ್ರಮೇಣ ಶಾರ್ಟ್ ಟರ್ಮ್, ಲಾಂಗ್ ಟರ್ಮ್ ಆ ಥರ ಸರ್ವೀಸಸ್ಸು ನಮ್ಮಲ್ಲಿ ಕೊಡ್ತೀವಿ ನಾವು.
Okay, thank you. This is the first facility where we have dialysis in-house. So patients who require dialysis don't have to travel. So 80 and 90 plus years who wants to have dialysis can stay here, take the dialysis, been seen by a geriatrician and nephrology team, and they can maintain that quality of life. We don't want dialysis patient to just stick to a hospital and in the travel time anything can happen. So for that, this is a more ideal solution where they can take part in the community, where they can be with other patients, spend their time, take part in activities as well as come for dialysis, so that they won't feel like they are stuck with a hospital or frequently visiting hospital. So this is first of its kind, and we require your support to take it forward. Thank you, sir. Karnataka Government of Karnataka. He has sent his best wishes for us. He has made his person available to join us. Thank you, sir. And Chief Guest Dr. Harsh Gupta, IAS, Principal Secretary, Health and Family Welfare, Government of Karnataka. We met sir a few months back regarding the things he pointed out, making the healthcare affordable.